Hey everyone, today's lesson from ACLS Certification Association is on Acute Coronary Syndrome. Don't forget to visit us online at ACLSCertification.org to certify or recertify your ACLS, PALS, BLS, or NRP 100% online. Now, let's get started. All students of ACLS must have the knowledge to identify and manage patients with acute coronary syndromes, also known as ACS, which in itself is an advanced skill. Patients with acute myocardial ischemia, also known as unstable angina, non-ST segment elevation myocardial infarction, or NSTEMI, and ST segment elevation myocardial infarction, or STEMI, are medical conditions under the ACS umbrella. To distinguish one category from another, a 12-lead ECG is mandatory. Based on ECG results, a patient with ACS may be diagnosed with ST segment elevation with ongoing acute myocardial infarction, ST depression, myocardial ischemia, or non-diagnostic or normal ECG. Critical to the success of treatment is the early management of ACS utilizing reperfusion interventions. Acute ischemia can progress rapidly into sudden cardiac arrest or hypotensive bradyarrhythmia. Considering the patient's clinical history, physical examination, and 12-lead ECG findings, the clinician must anticipate the treatment strategies to address the current situation of the patient. This may involve defibrillation, drug therapies, and pacing for symptomatic bradycardia. Patients with ACS are prone to developing ventricular fibrillation during the first 4 hours after the onset of chest pain. Mortality in this case is likely a product of VF or pulseless ventricular tachycardia, especially in the out-of-hospital cardiac arrest. We stress the importance of local community leaders in developing policies to address this situation and produce systems of care that coordinate with the local emergency medical services. In the pre-hospital setting, laypersons must be trained in basic life support and first aid. EMS must be adept in determining if a victim is likely experiencing myocardial infarction versus other causes of chest pain. This requires constant training and practice. They are ready to perform CPR and early defibrillation with an automated external defibrillator if the situation calls for it. It's the goal to provide reperfusion therapy as soon as possible to increase survival rates. Reperfusion therapies aim to dilate the occluded coronary artery. This involves percutaneous coronary intervention or stenting. It may also entail the use of fibrinolytics, drug therapies that improve blood flow to the myocardium by dissolving any occlusion. The Acute Coronary Syndrome algorithm aids to guide responders in performing the necessary steps in the assessment and management of patients presenting with signs and symptoms of ACS. In the pre-hospital setting, it is the responsibility of EMS to address the immediate assessment and perform the initial interventions in such patients. Treatment that will be discussed in detail later on may involve the use of oxygen supplementation, aspirin, nitroglycerin, and morphine as needed. At the scene, it is necessary for EMS to quickly record the patient's 12-lead ECG to guide both the clinicians in the hospital and EMS in the field on what interventions to consider next. Depending on the 12-lead ECG findings, responders may be guided to either start adjunctive therapies or perform a reperfusion intervention, such as administration of a fibrinolytic. Some patients may require close monitoring and serial troponins in the hospital to rule out ACS. A checklist is available to be used by responders to evaluate if the patient can undergo medical treatment by fibrinolysis. The ACS algorithm aims to triage patients based on patient symptoms and signs and interpretation of the 12-lead ECG. Some tests may be requested when the patient arrives at the hospital. For example, patients with ACS should have labs ordered, which may include CK-MB, troponin, coagulation studies, and other tests. For STEMI patients, providers may administer fibrinolytic therapy or perform diagnostic coronary angiography with possible angioplasty. That's it for our lesson today. Thanks for watching, and remember to check out our website at ACLSCertification.org for more free content or to get certified or recertified online.